medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Sometimes simplicity is a lot of fun. And when it comes to lab work and patients, sometimes the simplest blood tests that we learned in our schools respectively and maybe never thought about again might be an important component to our armamentarium in developing what's going on with that patient and a protocol. Well, the erythrocyte sedimentation rate, or ESR, is a test that measures, if you recall, quickly red blood cells settling at the bottom of a tube of blood. You know, it's a non-specific marker of inflammation. So you may say, well, why do I need that? Why bother? Well, I do it all the time. And I do it because it rules out so many other disorders in the face of it being normal. An elevated ESR typically indicates the presence of inflammation, infection, or certain types of cancer. And when it gets very high, we start to think about certain diseases. When the SED rate gets somewhere around the 60s and 70s, is there an inflammatory bowel disease? I know if the SED rate gets above 100 and that person has cancer, there is probably significant metastasis that's occurring. The ESR can serve as a baseline measurement and to changes in the patient's condition over time. And it's very helpful, inexpensive, and a very good differential diagnosis helper, I call it. It can help the practitioner monitor various conditions. In other words, as you put your protocol into place, a week or two later, are we starting to see the decrease in this inflammation? And you know, the nidus for so many diseases is born in inflammation. So this becomes an extremely important component for me in the monitoring and the diagnosing of a specific individual. It can also be used to track the progress of a disease for the effectiveness of the treatment, which I was just talking about over time, watching it. The ESR can easily fit into any clinical program because it's simple, inexpensive, as I said, and can also provide valuable information about a patient's health. And it can be used in combination with other blood tests you're getting to get a clinical assessment to help make you an accurate diagnosis and obvious treatment decisions. Basically, it's a great benchmark for an annual physical deep blood test evaluation. Now, let me give you one example of how I use it, and I use it with other blood tests. I do high-sensitive C-reactive protein simultaneously with the sedimentation rate side by side. I do that because the high-sensitive C-reactive protein basically lets me know if there is inflammation in the lining of the vascular system, meaning something that's more cardiovascular borne. The SED rate is more towards the entire body. So you can imagine, if I believe someone has a certain disease and their SED rate's normal, but their high-sensitive C-reactive protein is elevated, then I'm thinking more that it's cardiovascular in nature. Opposite, if the SED rate is very high, but the C-reactive protein is low, I'm looking more for what's happening in the body. I hope this makes sense because it's such a simple, easy test to do, and its use serially is easy because it's inexpensive even for patients that are paying cash price for it. For more information, please visit our website at drmitchghen.com. That's drmitchghen.com. And as always, I certainly appreciate and thank you for watching.